Designer drugs, advanced diagnostics, alternative therapies, all weapons in the warfare being waged on the front line of American healthcare. And researchers are persistent in their pursuit of new ways to arm the medical arsenal.
It is responsible for killing 3 times more people in America per year than cervical cancer. The 5-year survival rate is only 50%, accounting for 8,000 deaths each year, and it is the 6th most common diagnosed form of cancer in the United States. Presently, 30,000 patients are diagnosed annually, and 25% of all newly diagnosed cases have been in patients under the age of 40, with none of the known risk factors. Every hour of every day, in America, someone dies of oral cancer.
I think the media is extremely important in emphasizing anything in terms of the screenings that are involved in the cancer arena. Again, oral cancer is kind of a hidden disease. President Nixon back in the 70s had a war on cancer, and we're winning the war on cancer. Every cancer survival rate has increased, with the exception of oral cancer.
Oral cancer is one of the few cancers for which the survival rate has not improved in the last 50 years. This is due primarily to the fact that during this time, we have not changed the way we screen for this disease. And as with any form of cancer, the key to survivability is in early detection. After an informed public that is knowledgeable about the risk factors for oral cancer, the dental community is the first line of defense in early detection of the disease.
I think dentists are the first line of defense against oral cancer. I think it's important the dentist sees the patient twice, sometimes 4 times a year, many more times than they see their physician, their gynecologist, their ENT. I think that nationwide, why dentists don't use this technology is, number one, it's just a new technology. A lot of dentists aren't aware of this technology and what it can do for their patients.
According to the American Dental Association, one of the real dangers of this cancer is that in its early stages, it can go unnoticed. It can be painless, and little in the way of physical changes may be obvious. The fact is, the average person routinely has conditions existing in their mouths that mimic the appearance of precancerous changes and very early cancers of soft tissues. However, recent breakthroughs in diagnostic technologies such as VELscope are providing dentists the ability to detect this deadly form of cancer in its earliest stages.
The way the VELscope works, it's a blue light that is shined into a patient's mouth that then reflects off the patient's tissue. When that reflection comes back into the eyepiece, there are a number of filters which filter out different wavelengths. The dentist is then looking at tissue and discerning what is normal tissue and what is abnormal tissue. Normal tissue is tissue that gives off a fluorescence. It naturally metabolizes. Abnormal tissue does not give off a fluorescence.
Developed by the British Columbia Cancer Agency in collaboration with MD Anderson Cancer Center, this FDA-approved technology emits a safe blue light into the mouth, enabling the dentist to immediately view the different fluorescent responses to help differentiate between normal and abnormal tissue, something not possible with the naked eye. Fortunately, with early detection, the survival rate for oral cancer is very high. That's why an annual screening as part of your regular checkups is important.
6 months ago, I came into Dr. Green's office for a routine cleaning, and he detected a spot on my cheek, on the inside of my cheek, and used the VELscope on me. The VELscope is a painless instrument. It's like a flashlight. They put it in your mouth and it shines a blue light and it detects anything that's inside your mouth. And they did detect a lesion on the inside of my cheek, which was oral cancer. And thanks to VELscope, I was able to have my biopsy done right in this office. It was painless, and the VELscope is painless. It's just like a flashlight. I do believe that every dentist's office should be equipped with this. The technology is unbelievable. It's just unbelievable. It saved my life.
To learn more about VELscope, call 1-888-541-4614 or visit their website at www.velscope.com.